I could not believe that I was being presented with this honor, with this opportunity. When I was growing up, I was obsessed with Barbies. And my sisters and I, we would always play with Barbies around the house. And I always used to envision that they were doctors or that they were performers and poets. And so it really helped to spark my imaginative play as a child. For young children who play with dolls, it's very important that they're able to see themselves reflected in the toys that they play with, because it helps to spark that imaginative play. If they are playing with a doll that is similar to how they identify, and that doll is an astronaut, or that doll is a doctor or a lawyer or a singer or songwriter, then they might be able to think, I can also see myself doing this, and that can be really important for them. From within Barbie, there's this understanding that there is this dream gap. And what that is that at the age of 5 years old, girls already start to believe that there are limitations to the capacity of what they can do. So at Barbie, they really talk about closing that dream gap. And that's why it's so important for them to have this incredibly diverse doll line that features Barbie doing a variety of different professions, a variety of different interests, such that we can really start to address that dream gap and close it. When I got to U of T, I quickly learned that there were no other Black medical students in my year. I was incredibly fortunate such that there were upper year Black medical students that I could connect to and find that solidarity with. However, it was definitely a moment of heartbreak and disappointment when I recognized that narrative was going to continue. And, what made it particularly challenging was also seeing that having to face the micro and macroaggressions within medical school, which one might think that medicine is almost immune to these kinds of things, that we wouldn't find racism within medicine against the doctors even. However, that's not necessarily the case. There are so many Black Canadian physicians and Black physicians, I would say, outside of Canada as well, who share that story of, well, there was only one or two of us in my medical school class, or I was also the only one, or recognizing that some medical schools have gone a year or 2 years more than that where they didn't have any Black medical students. And so that narrative, when I decided to share it, there was just this outpouring of other Black physicians who were reaching out to me and saying, like, your voice is also my voice, and that this is also what happened to me. And past and present medical students who were saying, so much of your narrative I identify with. So being a Barbie role model, what that means for me is truly the opportunity to be a beacon of representation, but to also highlight the incredible strides of healthcare workers around the world, especially during this incredibly unique and challenging time that we've been facing collectively. And that really speaks to the power of representation and being able to inculcate this sense of possibility and attainment, that young girls can see themselves in me and think, if she can do it, I can absolutely do it, that they can be anything.